Hello and welcome back to another episode of Breaking Barriers. As we discussed in our previous episodes, our focus for this season is the significance of digital transformation in the healthcare sector. My guest today is Jacques Lirette. He is a senior director, executive service at Infotech Research Group. Jacques has been serving the healthcare sector for the last 25 years in a variety of IT leadership roles. So without further ado, let me welcome Jacques. Hello, Jacques. How are you doing?
Hi, I'm doing great.
Excellent. Thank you for sharing your valuable time with us. Would you like to share more on various roles you have worked in? And may I also ask you to share a fun fact about yourself?
Yeah, I've held a variety of different roles, either directly in healthcare or serving healthcare. So I was a CIO for a hospital for about 10 years. And then after that, I worked in a variety of companies selling IT solutions to healthcare, assisting companies preparing their message for CIOs and so on. So I've had a variety of roles within serving healthcare or in healthcare. And a fun fact, I'm an advanced scuba diver, and one of the things that I love to do is go dive where there's sea turtles. It's kind of a passion of mine. And last year, I had the pleasure of diving in one of the places where my hero Jacques Cousteau was diving in Thailand. So it's one of those things where if I could do it every day, I would.
Excellent. That's interesting. So how many different places have you gone and died?
Um, Interestingly enough, I only started diving later in life. So I probably have about 50 dives so far, and I've dived in the Caribbean, mostly in Thailand.
So that is 50 more dives than me. It's a passion for me too, but I have not been able to get around and get my certification. I do a lot of snorkeling, but I've never done scuba dive. That is something on my bucket list, and hopefully this year I should be able to cross that off my list.
Well, it's something that is very it's fun and relaxing to do. So it's a great thing.
I bet. I bet. So let's get back to the main topic on the serious note. Challenges that our healthcare system is facing today and how digital transformations can solve. So please share with our audience from your vantage point, what do you think are the critical challenges being faced? And if I may ask, can we break those challenges by various entity types, such as providers, payers, pharma, medical device manufacturers, regulatory agencies, um, and most importantly, the patient?
Sure. So why don't we start? Why don't we start with the patient? Because I think uh, that's where the challenges for the rest of the system comes from. I would say today, with the amount of information at the disposal of patients, they expect greater service, rapid service. They expect access to the healthcare system in ways that they access every other aspect of their lives. So when they do banking, they go online and do banking. When they go uh, when they want to consume media, they go online and they consume media. And the challenge for the healthcare system is being able to respond to those needs in the way that a consumer is looking for services. And that's putting a lot of pressure on the different levels of service delivery. So if you look at the primary care physician, one of the challenges that they have is that for the most part, patients come in with more information at their disposal that the primary care physician may have, and they've almost pre-diagnosed themselves. So by coming in fully informed, it puts a lot of pressure on the primary care provider to quickly and properly diagnose and properly recommend course of treatment. So when you go one level up, then from primary care, then you have the the acute care or the hospital sector or the private care facility that has a lack of data. So you have there's so much a discrepancy between the connectivity between the different care providers that the flow of information doesn't readily go from one provider to another. So there's a disconnect between primary care, and there's a disconnect between acute care, and there's a disconnect between private care, whether it's a physio or whether it's a radiologist or whatever the practitioner may be. So one of the big challenge for the system as a whole right now is connectivity and data sharing. And what's putting pressure on organizations to overcome is all the pressures. Financially, how do you build a system fast enough to be able to accommodate the need of a consumer that changes their iPhones every 3 years and expects their applications to be renewed every 3 years? And so how do you build that infrastructure and information systems that meet those needs?
So,
Second, yep.
Yeah, go ahead.
So you've got financial pressures. You also have pressures from leadership of organizations to also restructure and modernize the healthcare system. So you hear about all these jurisdictions across the country or even internationally where there's mergers and acquisitions in hospitals in the hospital systems in the U.S. or in Canada. You have mergers and acquisitions forced by government. So regionalization of healthcare delivery. So the continuum of care is really suffering because of that. So there's a lot of pressure on organization leadership to consolidate the system. And that puts pressure on the digitization or going digital for that matter.
So here's my question, and excuse my ignorance, but having been a servant of healthcare and IT for past 20 plus years, 25 plus years, I have a hard time understanding why these pressures are unique to healthcare. Because you mentioned an example of online banking and banking as a whole. There's a lot of M&A that happens in banking industry as well. May not be so much in Canadian space. You have very stable 5 banks, but if you look outside, there have been a lot of mergers and acquisitions within the financial industry and sector. But they are able to transmit data, and I always give this example that I travel a lot because of work. And if I have to be in India, for example, and then I need some money, I will just go to an ATM machine and insert my Canadian Interact card and enter my PIN, and the machine will dispense me money. And that machine, that Interact machine that I went to, or ATM machine I went to, could be of any bank in India, for that matter. And they will be able to identify me, validate my PIN, communicate with the bank in Canada and dispense the amount of money, and then put proper credit into my total balance. And all of that happens within minutes, if not seconds. So that interoperability of data is the question that I am not able to ever put my arms around as to why data from physicians' EMR, my PCP's EMR, cannot get transmitted to my hospital's EMR, and vice versa. So what, in your point of view, are the real challenges that these systems cannot communicate? I'm pretty sure the banks in India may not be using the same information systems that banks in Canada are using. So help me understand that.
So I will answer that really with 2 points. The first point is data standardization. So in healthcare, there's so many different systems that are in place that are EMRs of different varieties and flavors, and the consistency and the data standards for the complexity of that data is not easy to transmit from one system to another. So that is definitely where the biggest challenge is in terms of data sharing. But the second aspect of that is monetization. So in the banking systems, there is financial rewards for transmitting that data from one institution to another because the customer, there's usually transaction fees attached to it. There's usually a monetization process where when banks exchange data or use another ATM of another bank, because the data standardization is better on the financial side for communicating transactions than it is on the healthcare side. It's easier to do. And the second thing is that there's monetization. So there's money changing hands to accommodate those consumers that travel. So there, in the healthcare system, that's not there. So there's no financial incentives to build those connections in the healthcare system as it exists in the financial systems.
So I will push you a little further on this. Again, one standard. So there are standards, right? XL7 has standards. NSI X12 has established standards. And if those standards are not complete, then we have been in this information revolution for past 40 years now, at least since 90s, if not more. Then why could we not get these institutions to get to those standards, like financial sector, A, and B, monetization of these things, which is a very valid point, where transaction fees are applied and individuals end up paying. But that can be embedded in our healthcare cost, right? If it will end up reducing the total cost of care being provided, because there's no doubt in anyone's mind that if we have this free flow of information flowing from PCP to acute to radiologists to pharmacies and all that, we will see a decline in number of procedures being performed, number of tests being performed. So the total cost on a system will come down. And who end of the day end up paying these costs? You know, in Canada, it is very easy and simple. It's the government, provincial governments. In US and other sectors, it's the health insurance companies. So they definitely, these entities will be willing to pay that 15 cent or $1 transaction fee if it actually boils down into saving system costs.
Totally agree, and that argument has been put forth by many governments or many consumer-driven healthcare advocates. You see that all the time. If you improve access to the healthcare system and you improve the efficiency, there's payoffs. The challenge is that right now the healthcare system is siloed. So there's no, even though the benefits to the overall healthcare system may be there, the incentives don't spread across the spectrum. So primary care is a silo. Private care for some specialties that you get private services for is another silo. You've got hospitals that are a silo. You've got long-term care that's a silo. You've got ambulatory care that may be another silo, depending on which jurisdiction we're talking about. So it's easy for us as IT professionals to look at that and say, wow, if I take that whole system and I improve efficiency and I improve all the communications and we produce a healthcare data system that's equivalent to the banking system, and quite frankly, it's not a fair comparison because the complexity of the data is way different, but it's still, it's the model that people tend to go to. If I can walk into any institution around the world and get some money, why can't I go and get healthcare the same way? And it's just because all the different silos have built different systems for themselves, and the data standards are not there to push it, and even the financial incentives coming from taxpayers, even though we all want it, nobody wants change. We've seen governments try to implement change and try to consolidate change. If you make your organizations more consolidated, you have a better chance of sharing data within that organization. But people don't like that change. People don't want to see change to their physical healthcare infrastructure that's been in place for decades, and that's the primary challenge. In the U.S., I have the pleasure to work with some large healthcare institutions in the U.S., and they don't see it that way. They see it very differently. There's a lot more data sharing and a lot more transactional kind of systems in the U.S. than there is in Canada because it's business driven. The insurance company has a vested interest in making sure that the rest of the system's more efficient, and vice versa because it's all based on profit.
Yeah, I had a pleasure of attending a conference last Friday, which was focused on analytics and artificial intelligence, and there were a lot of sharp minds presenting at that. And one of the questions that came up was the same question: why, when artificial intelligence, the fuel to artificial intelligence is data, and free flow of data between different systems and different entities is key. Why we are not getting that? And there were some senior government regulatory individuals at that. And the point that they mentioned was the ownership of data. The challenge, the biggest contention that happens is that people don't want to share data. I was talking to one of the physicians over there, and he mentioned a scenario where a kid had a trauma, went to a hospital, they did a CT scan, they found some real challenge, it was a kid. So they transported that kid over to sick kid hospital. They transported the kid, but they didn't send the scans. So now, even though the whole hospital staff was ready to operate, there was a delay caused because now they had to do again all those scans on that kid, which was insanity from my perspective. But again, that interoperability of data is lacking, and a lot of reason is who owns that data? Do entities have trust on each other? What kind of security, what kind of privacy do you need to have that data being flowing? And you're right, financial data is a lot less complex than healthcare data. And the privacy, because of the negative ramification that can be caused by leakage of that data, a lot worse. Therefore, a lot more stringent regulations have to be around that. Especially the HIPAA in US has been very, very stringent, and a lot of penalties get applied. So there has to be something that needs to be done. So let's talk about now the disruptors that are out there, like blockchain, that can have that ledgers being encrypted and that trust can flow. What kind of trends are you seeing that can help us remedy these challenges in next 10 to 15 years?
It's interesting. Blockchain has a lot of promise because it has the ability to identify, document who and what entities are looking at a specific amount of data and do transactions and record it. And I mean, I was at a conference last summer about the future of blockchain and where all the different kinds of opportunities were. I do believe that healthcare is going to benefit from blockchain. I don't think it's going to happen in the near term because healthcare is usually a laggard in adopting new technology. It needs to be proven in other sectors first because healthcare is just risk adverse for the right reasons. But if you look at blockchain, I think that's an interesting area where that technology can be used to secure transactions and authenticate transactions. Because the biggest thing about unauthorized access is authentication, and we do have a lot of issues regarding identifying the right provider to be able to show that information that's in the systems. So I think that blockchain is one. The other area where I think we're going to see some development, you mentioned AI. I think the challenge for the infrastructure healthcare system that we have today, which is in Canada, which is public, we're going to see some pressure from virtual services that are going to come online using AI. As soon as you have enough data to be able to do a diagnosis, AI will be able to diagnose patients on certain things probably better than human beings can. So we might see services coming out from the private sector that you can go online and fill out a form, or I don't know what the future holds, and the system will come back to you and say, hey, why don't you do this, and maybe you've got this. And I know that may sound scary, because if you talk to providers today, they're going to say, wow, AI is really promising, but it's never going to replace us for in the near term. And then if you talk to people, or if you talk to individuals, what they want is access. They just want access to care. So whether it's online, which is what they're used to now, or they go physically somewhere and you make that easy, it's all going to be about access. So I think AI is going to play a big role in improving the efficiency of the healthcare system, even assisting providers in delivering faster and better and more accurate care, and more care plans that are dedicated to a specific genome or specific DNA. So we're going to see treatment change as a result of AI. So I think AI is going to play a big role in the future. The other thing, the other aspect, that one of the trends that I'm seeing is the amount of data that's being collected by individuals. So if you think about the fact that you've got millions of people walking around the world with smartwatches that is collecting biometric data from the person that's carrying it in almost real time, and that's all being collected by companies such as Google and Apple and some of these big firms that are producing this technology. All that data is going somewhere, and it's not going into the public domain. It's going into the private domain. But all that data is going to be, at some point, you would think somebody's going to want to leverage that data for either good or evil.
So let's not go into evil side, but even from good perspective, there's a lot of counter arguments on that as well. I was reading an article recently that indicated, how do we authenticate the data, A, and how do we ensure that that data is accurate? You know, so that's another philosophical debate that is going on. You mentioned about wearable devices that people are wearing, and recently, I think Apple got an approval for their ECG. But the question is that ECG done at physician office under controlled environment, would physician provide their care based on that data, or the data that is coming from a wearable that they are doing at home, and we don't even know under what circumstances and how authentic that data and how accurate that data is?
That's a really interesting question, because as the technology evolves, the data is getting more and more accurate. And I would challenge the regulatory bodies to be able to certify equipment in such a way that we would know, based on the certification of equipment, whether that data is accurate or not. So if you think about I'll go use the ECG example. So let's say that if you walk into a hospital or a healthcare provider and you get an ECG, there's a piece of equipment there that's been built by X, Y, and Z that has been certified either by Health Canada, or it's been certified by the FDA, or it's been certified by some standards body that makes sure that it's been tested. And as wearables become more and more advanced and more capable, there's no reason why those devices can't be certified as well. And the question of accuracy, there's always going to be errors, but for the most part, as the technology refines itself, it just gets better and better. And when there's going to be different kind of healthcare events in your life that require a higher level of accuracy. The fact that I'm wearing a watch that's measuring my ECG, the only time that this would need to be accurate is if I'm having a cardiac event and my watch basically recognizes I'm having a cardiac event, and it notifies the authorities or first responders to come to me because something just happened. That's a very different circumstance, because you're dealing with an episode of care, as if you're just managing trends. So if my watch is measuring my ECG, and all of a sudden I go to my primary care physician and say, oh, by the way, here's my last 6 months worth of ECGs. Is it 100% accurate? No, there might be reasons why it's not, but it's good enough to trend. And in healthcare, when they treat patients, there's two types of well, maybe there's more than two, but the two primary ones, it says an episode of care. So if something's wrong, you need to go get it looked after. That's when you walk into the healthcare system. So you go see your hospital, or you go see some kind of practitioner. And then there's the other kind of care, which is just preventative. You're taking care of yourself. You're going for your annual physical. You're doing your regular blood test. So that's more on the maintenance side. I think on the maintenance side, your data doesn't need to be as accurate all the time as an episode of care. Does that make sense?
Yeah, I agree with you. I'm a big proponent of preventive care, because the episode of care um, at acute care is the most expensive. When it can be dealt at PCP, it's a lot cheaper. And if it can be dealt at home, then our cost will come down drastically. And that is what these preventive and predictive devices will allow us to do. And hence, we are seeing a lot of product development. If we look at last 6 years worth of data, I read somewhere that there was, on average, 47% year-over-year growth in new product development in the space of wearable devices. So this is a trend that is definitely here to stay, and it will transform. It will transform the way care will be provided. A well-being of a person will be monitored and improved in coming years. So I completely concur with you on this.
And the one challenge that the healthcare system as a whole is going to have, and we're already starting to see it, is the amount of data. Right, the amount of data that's being collected. There's a startup in Toronto that is building it's already beyond prototype, and it's a blanket that when you put it on a patient, it monitors ECG, temperature, movement, and the sensors are built into the blanket. So when you put that in a hospital, all of a sudden you've got a bunch of data that's collecting in real time that needs to go somewhere. And if you make more and more devices in your healthcare institutions collect that data, you need to store it, manage it, secure it, analyze it, respond to it. So there's all this work that needs to go that I'm not sure the healthcare system is ready to handle.
I completely agree, and that is why the topic number one that we were discussing, data, because we all acknowledges that there will be a truckload of data that will get generated by various devices, and by different entities and vendors. How do we improve interoperability, which means if there's a data sitting at a PCP versus hospital versus Google versus Amazon versus Fitbit, it can interoperate and can get transmitted and received by these entities. A. B. How do we trust that they are data for that patient and not for someone else? And C. We can ensure the security of that data, that people are not going in and changing values and getting it into the care continuum, and people now starting to do diagnosis on incorrect data. And then the final one is privacy, that data does not get leaked and get into those evil hands that we kind of now want to talk about on this chat today, at least. So those are, in my mind, 4 pillars that will establish the way data is going to be consumed by people. So who owns the data? How do we ensure the patient have control over where and how the data is shared and used, is the question that I think is paramount and must be answered in coming months and years for this whole thing to take shape.
I totally agree. This whole question about custodian of the data and the source of truth is one that's going to be, or is, an immense challenge, because if you ask who owns the data, you'll get the majority of the time you'll get an answer, it's the patient. But in reality, the patient isn't it may own the data, but they're not the custodian of it. And it's this battle between the ownership and custodianship that makes it difficult to share data. If you have organizations that are custodian, by that they are responsible for securing privacy, make sure that nobody has inappropriate access, and that's an immense challenge. And it continues to be and will continue to be probably the biggest challenge when it comes to sharing health information.
I agree. The end of the day, it all needs to translate into a longitudinal record for that patient. And if the data is sitting in disparate systems and we are not able to generate that longitudinal record for Chiranjeev Devgan, then it is of no real benefit for Chiranjeev Devgan. When anyone who's providing care for Chiranjeev cannot see data for Chiranjeev, then that transparency and that benefit will be lost. That's where I think we need to go. So let's talk about other opportunities. So 5G, what is your take on 5G? And how do you see 5G impacting and transforming healthcare?
I would think, well, I don't even know where to begin, because 5G is going to be transformative for sure, but not because of just 5G, but it's what 5G enables. So if you looked at and I've have had the opportunity to work with some startups here in Toronto, and even some of the work that's developing around the world, is that this connectivity is going to provide high bandwidth, high availability, and very low latency networks, which means that you can control and manage devices remotely and large numbers of them. So if we go back to the conversation about the smartwatch. Well, in a world that right now, there's technology being developed that's not just watches. It's going to be in your shoes, it's going to be in your shirts, it's going to be in your clothes, it's going to be in your glasses, it's going to be, so all this embedded technology that's going to communicate data is just going to grow, and it's going to be available in large numbers and in large areas. So if you think about all of those developments that are happening on the IoT side, or the Internet of Things side, on the healthcare side, there's going to be so much technology being built because of the bandwidth capabilities to transmit data real time. You'll be able to build a device, which are being built today. You'll be able to build a device that'll collect some kind of information, transmit it back to a data center, which will be able to process, analyze that data, and then tell the device to do something. So imagine if you're a diabetic and you have an insulin pump that you monitor personally every day, and you're looking at that. Well, think about that in a world where you won't even need to look at it. It'll be measured based on your biometrics, and the insulin pump will just do what it needs to do based on AI, because of all that data that's going to be sitting up in the cloud. The devices don't need to have a whole lot of intelligence. They just need to be able to communicate to something that does. So it changes the way that devices will work. And in the medical world, right now, those devices aren't connected, and they're all over the place. And in the very near future, they will be connected, and they'll be collecting all this data, and they'll be able to improve the quality of care because of it. Medication dispensing is one. It could even be something that is wound care. If you've been wounded and you need to measure your wound succession, you'll have bandages that'll be connected to a device that will monitor how well you're healing. There's all kinds of technology being dreamed of right now that is being prototyped that 5G will enable.
Fantastic. This reminds me of Star Trek.
Well, it just goes to show you, right now you have devices that need to be connected to a very high bandwidth network in order to operate medical diagnostic equipment that will be able to be put into a smaller box, because we're now able to do, and it'll just be mobile. And if you think about things that are physically connected to something in a hospital, it'll be able to be remote, and it'll be in a smaller case.
Okay. So next topic that I want to discuss after 5G is telemedicine. So what do you see the future of telemedicine in 2040?
I'm going to just put my kind of creative hat on to answer that one. One of the things that we need to kind of understand is that the world population is growing at a pace that is unsustainable in the sense of building traditional healthcare delivery. You can't build hospitals for all these people, and the public purse isn't deep enough to continue building hospitals the way we built them. And so we're going to need to rely more on telemedicine, if that's the word that we're going to use today. I'll call it virtual medicine in by 2040. The other aspect of that is the amount of people we need to train, our physicians and our care providers and the people that are providing care today. Again, we're not training enough of them. There's a shortage of clinicians today. So imagine when the population is growing around the world, what you're going to see is this virtual medicine coming out of, maybe it won't come out of Canada. Maybe it's going to come out of the developing world, where they've got more facilities to train, supplemented by AI. I'll be able to look into a camera. The camera will do a biometrics of a scan of my biometrics and say, okay, it looks like you need this, this, and this, and we're going to prescribe it to you, and then Uber delivers it to my door.